We are back with more What's Now, continuing to focus on your health. Right now, specifically on heart disease and Black adults who are more likely to die from heart disease than any other population. I recently spoke to a physician about this, as well as a woman who has 3 heart attacks and is a survivor. Let's take a look.
Black adults are more likely to die from heart disease than any other community. Our reality worsened during the pandemic, which is why the CDC Foundation is launching the first national cardiovascular disease prevention campaign, created specifically for Black communities. February is both America's Heart Month and Black History Month, which makes the Live to the Beat campaign launch timely for the community. Joining us today to learn more about the campaign is Dr. Waddell, Chief Medical Officer for the CDC Foundation, and Tara Robinson, a 3-time heart attack survivor, founder and CEO of the Black Heart Association. Thank you, both of you, for being here.
Thank you.
Thank you.
Dr. Waddell, how does the problem of cardiovascular disease especially impact the Black community?
Well, we have a significant problem with cardiovascular disease in the United States. 1 in 3 deaths in the United States is due to cardiovascular disease. And in the Black community, we die at a rate 2 times that of those in the white community. And it's important to know that nearly half of all Black men and women in the United States are living with some form of cardiovascular disease. We have some of the highest hypertension or high blood pressure rates in the world in the Black community. And we also concerned that cardiovascular deaths are rising in the younger population between the ages of 25 to 65. So we've got these significant disparities or differences that are happening in the Black community. And that's why we've got this good news to share about the Live to the Beat campaign to help us address this.
Doctor, when is now the time to talk about heart health for Black Americans?
Well, now's an ideal time to talk about this. We've seen during the pandemic the significant health disparities that have been unveiled, and we've seen that cardiovascular disease death rates have increased during the pandemic. So there's a lot of attention to this issue of health equity. And we also have information that tells us that while folks are knowledgeable and aware of cardiovascular disease, there's always an opportunity to continue to increase awareness, but also to build the confidence and the belief that there are things that we can do. And we've got this campaign now to launch, so it's a great time to do that.
Tara, tell us about your experience with heart disease.
My experience with heart disease started in 2013 when my left arm went numb and my neck started to bother me. From there, it continued until April. On April 10th, 11th, and 12th, I experienced heart attacks. 2 went undiagnosed, and the 3rd one ended in a massive heart attack with 99% blockage in my left artery, and even going into sudden death during the operation. And from there, I've been taking small steps to do better, to take care of myself, to live to my own beat on this journey. And I even started the Black Heart Association in the process.
Dr. Waddell, what can people at home start doing today to improve their heart health?
There are a number of things that people can do, and we want your listening audience to know that small steps can have a big impact. And some of those small steps are around physical activity. Start your journey where you are ready. Small steps can be taking the steps more, can be taking a short walk down your street. Doing some knee lifts while you're waiting for something to warm up in the oven or the microwave. If you like to dance, you can move to the beat, put on some music and move around. Walk around while you're talking on the phone, but take some of those small steps. And then in terms of food, work on healthy eating, healthy fruits and vegetables. Take in more of those healthy vegetables in a healthy smoothie as a way of getting more of those vegetables in. And then another important step is to have a relationship with your healthcare professional where you really are getting your blood pressure checked in, particularly along with checking your cholesterol, your blood sugar, and having that relationship with your healthcare professional. Those small steps add up, and beginning them to the tune of your own beat when you're ready at the pace in which you can do it.
What are some final thoughts you'd like our audience to remember about this issue?
I think what's important to remember is that we understand that this can be hard, but it's about living and start where you are, no matter where you are or who you are on this journey. Start small because those small steps will add up. And we have lots of information at livetothebeat.org where you can get tips and tools on these small steps that can help you on your journey to a healthier heart and a healthier life.
Well, thank you so much, Tara and Dr. Waddell, for joining us today. Tara, I'm so glad that you're doing so well and use your experience to become the founder of the Black Heart Association. I'm so impressed with your story. And thank you so much, Dr. Waddell, for your time on this important issue today. Really appreciate you both.
Thank you.
Thank you.